I'll go over all the parts first, and then we'll just kind of apply it and go through it and go through torque drivers. And if you guys have questions along the way, just stop me and ask them, and then we'll go from there. So we have our vest and our upright rods, anterior, posterior. This is a synthetic liner. We have 3 liners: lamb's wool, Cool Max, and synthetic. So if someone's allergic to lamb's wool, we have other options for them. This is the ring, head pins, torque drivers are used to apply, spoon, and we have 2 Allen wrenches and the hex wrench. These are used for the ring, and they're also used for the patient if in emergency they would need the halo taken off. So these usually go with the patient. 3 brass positioning pins, breakaway torque drivers, traction bail, and then the surgical bed adapter, which is used for anterior posterior approach, and it hooks up to your Mayfield bed. So measurements for the patient: head circumference, centimeter above the ears and eyebrows. Then you have xiphoid circumference, waist circumference, and then shoulder to iliac. That gives you your measurements for your ring and then the vest. So we'll get this chart put on the cart, bring the whole cart up. So we'll have all these measurements on there so they can do the measurements and then pull exactly what they need. So once you have your vest size, ring size, the first thing you do is take the ring, the 3 positioning pins. The ring, positioning pins, and head pins are all sterile. Everything's carbon graphite and titanium, so it's all MRI compatible also. 1 pin goes on the most anterior hole of the ring, and then the positioning pads pop right on. Some physicians like to shave the back of the head where the pin's actually going to go. So if Dr. Gardner wants to do that, that's something you'll have to get something to cut the hair. And then once you position this onto the patient's head, usually they'll use lidocaine through the holes to numb the pin sites where the pins are going to be applied through. The head spoon's used to pull the patient's head a little bit off the bed. Otherwise, when you're putting the ring on with the positioning pins and pins, you're kind of always fighting the bottom of the bed. So this is used to kind of elevate them off. I'm going to pull this top one because it doesn't really stick in this styrofoam head. So as you're going around, just a couple twists for each one. Most important part to get the ring on is just to make sure that this is kind of symmetrical on the patient's head. When that's positioned, then you just kind of want to take a look at it, make sure it's kind of the same amount of space through the head. Look at the center pin, make sure it's kind of lined up with the belly button so that's all straight on. To that, you'll take the pins. There's 5 pins, there's 1 extra just in case one's dropped. You want to put the anterior pins on the outer 2/3 of the eyebrows. Make sure the patient's eyes are closed where the pins are going on so they're not pinned open. And then the bolts on the pins you want to back off too, otherwise it can kind of push up and stop the pin from moving forward. And also there's a sticker on the ring showing you where the head blocks go, so you don't want to use those for any of the pin sites.
So the positioning pins, direct center, and then the very last on each side. And then
Correct.
typically you're putting your other pins in according to above the eye.
Yep, so the outer 2/3 of the eyebrows on the anterior ones and the posterior ones, you usually just go
Behind
one
the-
side up from that positioning pin. So once those are moved forward, breakaway torques are used. This is the best way to put the head pins on. This way you can put 4 of these on and go diagonal, 2 people, and you can put all the pressure in the pins, set the pins all at the exact same time. If you use the torque driver, you have to go 1 here, down here, and just kind of keep going like you were doing a tire, kind of crossing over these. Tighten these down, and then at 8 pounds of pressure, these breakaways will break and they'll actually free spin, so they won't allow the pins to go any further. So then you have your pins in. You want to move forward the bolts. Take one of the Allen wrenches and the hex wrench to make sure that the pin doesn't advance anymore. Tighten. This holds the pins in place. Tighten. Remove your positioning pins. So the ring would be set. At this part, if the surgeon was going to do a surgery on the patient, this is the point that you could use your anterior and posterior. That's the big field adapter. The longer one's the anterior approach, so this just goes into the center hole onto the Mayfield, and then they can use it for positioning for surgery. There's the other one for a posterior approach. After that, the head blocks get applied. When you're applying these, you want to make sure it makes a T. There's a sticker right here that shows you actually the holes for the head blocks to go in. If it were accidentally put on upside down, that doesn't affect any structure of the halo system. It's just you're gonna have a little bit less range of motion actually positioning if they're gonna use this for anterior, posterior flexion extension. But if they're flipped, I'd leave them flipped unless the physician or you can't get them in the right position that you want, then you might have to go back, but it's still ample positioning to use. So these are the only 4 loose bolts in the system. These are used to put the head blocks on. Just hand tighten these. And when you're looking at these bolts, this is going to be your flexion and extension. These 2 are your anterior, posterior. Then there's a bolt up here. If if you want to apply more traction to the patient. And I can show you that when we can and get them up too. There's a traction bail. You can take the 2 top or 2 bottom bolts out and connect this on. You just screw that onto there, and then you have your S hook, and you can put them into traction that way. If they were going to use the halo system, if they weren't going to use the halo system, you can just use straight traction tongs. So at this point, the vest would be applied. On the blocks, it gives you front, and then it also gives you the pounds of pressure set to just 30. And someone would support the head, and you would barrel roll the patient and then slide the posterior portion of the vest under. Then you put the anterior on. The 2 plastic buckles go underneath the straps. Just helps support the vest. And when they're using the straps, you want to make sure that you're on the same hole mark as each side, which will kind of keep the vest in the center of the patient. So rods are removed, and then you just place these on the top. There's resistance if you kind of rotate it back and forth. They usually,
It's just because we didn't loosen it.
yeah. There we go. Then the torque drivers, they have 2 bits on them. This top part comes off. These are kind of C's because they're old, but you can flip them. So the larger one's for the vest, the smaller one can be used for the pins and the head pins. Okay, so we'll be setting the PMT torque driver for the PMT Halo system. As you see, there's 2 scales. There's a scale that's in the blue area, 0, hash mark 2, hash mark 4. This hash mark's 5, and then you're back to the scale. On the gold part, there's hash marks that are 6, 12, 18, 24, 30. So when you're setting it, you want your 0 in your left hand, go to the 6 hash mark, which is down here. And for the head pins, you want 8 pounds of pressure. So you hold the gold, pull the collar, and rotate your wrist clockwise to the 2. So the 6 and 2 will put you at 8 pounds of pressure. There's a double-sided hex. This black portion releases the hex for the smaller for the head pins, and the larger is for the vest and the superstructure. To go to 30, you want your left hand to the 0 again, rotate the gold part clockwise, until you're at the 30 mark, and that will put you at 30 pounds of pressure. The calibration dates are on the bottom and then also on the neck of the torque driver. The calibration dates are past due. You need to order a new torque driver. So that's how those are set. So we'll set one each, so you'll have them. Put the rods in, then you're at 30 pounds for everything. So these are the 2 anterior chest blocks, 2 posterior, and then you want to tighten all these down. Then once they're all tightened, it's applied.
Oh, I'm dizzy.
And then for your adjustments, like I said, these 2 are your anterior posterior motion if they want to readjust. It's your flexion and extension, and then there's a top hole up here that can be used, and it'll actually travel like another inch of traction. It's right there. Questions? That was quick, wasn't it?
Mm-hmm. That was.
And then there's a cardiac crease on it too. If the patient were to crash, remove the 2 side straps, and you could put a hand here and pull up, and this will crack, and you'll be able to lift off the anterior portion of the vest, so you can kind of get under there. These could be used to remove the halo. So I'd either give this to a loved one of the patient, or else if you want to, you can tape it to like the back of the vest, just in case they got in another car accident and they ended up in another ER, and these wrenches will remove the whole system and the pins if they needed to take it off. So